welcome everybody. 13, we will keep to our tradition to start on time. And I think from Secretariat we informed we are more than 30 participants registered, so we will they will come in. Okay, so we will just carry on, and most welcome to all of you, and from UKM, and as well as some of our partners from outside UKM, and the interested parties coming to join the session. Particularly, I heard we have said dissemination to simulation group as well. So today we're going to talk about debriefing, and we've invited Prof. SAIBOON to talk about debriefing, a very interesting, I think, a new concept. Well, they may not be so new. We'll hear more about it. And it was one of his Sharan Pradana. And then I heard, oh, this is something that we need to disseminate and maybe tell us a lot more. So this 1 hour session, we all will listen to the presentation as well as some Q&A. And also to inform all of you, this session is also live streamed on Fakulti's Facebook, right? So I will keep monitoring the other side of Facebook. Hopefully we'll pick up some questions there because they can't interact within the Zoom, right? So without further ado, I think Prof. SAIBOON has been leading simulations in our Faculty of Medicine, and has spearheaded the development of simulation in many ways. Yeah. So I think we will not drag on too much time for myself. Okay, Prof. SAIBOON, and you can introduce your team if you have a team, and the floor is yours, and we shall have Q&A. I will be also monitoring the chat and moderating the session. Thank you, Prof. SAIBOON.
All right. Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Very good afternoon. Thank you very much, Prof. Tong, for the very kind introduction. Okay, you all can hear me clearly? Just check first. All right. Okay. Yes. For this afternoon session, I will be speaking on this topic called debrief in clinical and healthcare health science teaching. I will be basically assisted by my colleague, Dr. Hisham, who are basically the one who are going to conduct some active learning sessions. All right, we've been talking about active learning for the couple of weeks, and then yesterday we had a good discussion on that. Okay, so okay, let me start with this slideshow. Okay, all right. So this is the third how I do it or Heidi session for this year. And just a word of disclaimer and disclosure, I am a healthcare simulation educationist, and I have basically no financial implication to disclose for this talk. Now, before I start, let me ask these questions. Why don't you all go to your handphone, open the Mentimeter, and go and type in this code 45283746. Let's see that. And yeah. Just a simple one question. 45283746. There is a question on about debriefing, whether you have actually do it or using it or nothing, or don't know what it is. You can just enter your answer. We're going to see. Out of 30, we have now 30 people roughly. Okay. Okay. I stopped sharing, and maybe Hisham, can you share your slide? Okay, good. So we have more than half. Okay, still coming. We have 6. Oh, still coming in. Okay, we have about 56% roughly. Those who have already experienced doing debriefing. This is actually very good. And about 30%, about 1/3, don't know what it is, and 9% does not have no experience doing debriefing. Okay, All right. Any more coming in? All right. If not, I think that's very good. About a third, about 2/3 have done debriefing, and I think this is very encouraging, because when I started doing debriefing, I've told you I've never heard about this thing before. And when we had a discussion this morning, I mean just now with Prof Tong, I was actually also just wondering how many of us have done debriefing or even heard of what it is. Okay, but just let's see whether the debriefing that you all have been doing is the same as what debriefing that I'm going to share with you. I think that's more important. Okay, let's see. Okay, all right. Now, if you talk about clinical teaching, I think one of the main aim is actually to produce someone, okay, a practitioner who are basically, one, is knowledgeable, okay. Secondly, is actually, it's not only have to be knowledgeable, but he have to be competent, all right, in doing things. The practitioner have to be safe, all right. And we have to, when he treat the patients or when he faced with problems, he have the ability to think outside the box, the ability to do that. And this is actually important, all right. And last but not least, a practitioner who is basically compassionate towards their patients or even their colleagues and so on. So these are basically, to me, a quality of a good practitioner. So when we do clinical teaching, this is what we want our product or our graduates to be. Okay, and there are many ways of how doing clinical teaching. We have bedside teaching, we have didactic giving talks, or we can play with computers, and or we can do a hands-on task training and so on. This is actually, for example, if you use simulation, this is actually some of the simulation modalities of what we do with simulators, but we also do non-simulators related technique or approach when we're doing teaching. So clinical based teaching is basically has a lot of experiential learning into it, because when we do clinical teaching, when we do the bedside approach, we bring the students to the bed and basically looking at the patients, and this is basically the experience that what the patient have and the experience of what the student will basically face. So there's a lot of element of experiential learning, and which basically experiential learning adapt to the constructivist learning theory, where the learners build up new knowledge based on the experience and the prior knowledge that they have. Okay, and when we talk about experiential learning, one of the thing that I would like to share with you is this thing called the CLOP learning cycle. For those of you are basically engaging with education, I'm sure you are all quite familiar with this. But for those who have not, then maybe I can just take a little bit of time to explain. So in CLOP learning cycle, it explains that the experience that you go through or the experience that the student goes through have to be concrete. It have to be a concrete experience. So meaning that it's a real experience. And that's why even we, when I say we, it's myself, when we're doing simulations, the experience that we want the student have is actually some sort of a very strong, impactful experience. Now, having going through the experience alone is good, but it's not enough. That the next phase is actually what we call as reflective observation phase in CLOP's learning cycle. So this reflective observation phase is when the student have gone through the experience, they start to do reflection, they start to think about it. All right. And basically they start to think of what they do, what they went through, how it affect them, and based on the experience that they have or the knowledge that they have, they then basically try to conceptualize this thing and form an abstract conceptualization. So that's the next step in CLOP cycle. So this is where they try to conclude things of whatever experience that they went through. Based on the reflection, they try to conceptualize it or make it the new knowledge. Okay, simple words, new knowledge is being created. But then doesn't stop there. It have to move to the next phase, whether this new knowledge is true or not. So this is where they try to basically try it out maybe on the next patient that they see or something. So this is what we call active experimentation, where they try or they plan out of how they can use this new knowledge. And if it's good, then it goes back to this concrete experience, meaning that what they learn or what they conclude is okay as they go on until they meet the next experience they go. So this is actually what PROF learning cycle is all about. And we in simulations do a lot of based on underpin our learning cycle on this PROF learning cycle. And when we talk about debriefing, is basically this. Because in PROF learning cycle, we allow the student, he doesn't say that whether the student will do it on themselves, but in debriefing, this is where we try to help the student to see back or to make sense what they went through. Okay, it's just, so debriefing is something like a reflection that we do for students who goes through experiential learning. All right, and like I said just now, clinical world, there's a lot of things we learn through experience. Even though when we read some books that give us some ideas, we go and see a patient, that's where really it clicks. All right. Okay, next slide. Okay. Now, so what is this debriefing is? First of all, it is not briefing. Okay, well, briefing so usually starts in the beginning. We want to tell people just an informative thing, tell people what this thing. And in fact, I try my level best to look into the dictionary to find what is the Malay term or the Bahasa Melayu term for debriefing. And until today, I failed to find one term that really explains about debriefing. A lot of them just say it's ulasan, but it's not really ulasan, you see, because it's not the teacher who's doing the ulasan. It has to be the student who debrief about those whole things. So debriefing is a facilitated, that's one word, and guided reflections in the cycle of experiential learning. So it is a reflection, but it is a guided reflection. Guided by who? By the facilitator. And usually it comes after the experience, or in simulation, it's come after we done through the experiential learning. Okay. And during debriefing, reflective thinking is encouraged. Okay, and what happened normally in debriefing is actually what we try to explore is what did the learners experience. Okay, we really care of what did they experience, because two people can go through the same experience but have two different perspectives of things. All right, so that's why we wanted to know. It's important to know what actually the student or the learners went through. So what did the learners experience? And what did they learn from this thing? All right. And thirdly or lastly is how can they apply to their future decision making or work what they learn. So these are the three main, the big concept in debriefing. What do they experience? What do they learn from the experience? And how can they apply? We want them to think. Because if you remember, in my just my third slide was talking about the quality of the features of the practitioners they want to produce. We want them to have the ability to think, because we don't want them to have the ability only to memorize everything and just regurgitate it all. Because when treating patient, you need to think. Debriefing consolidates learning. Then it is one of the most important parts if you talk about simulation or active learning. It's one of the important part of this of learning. And in debriefing, what we try to do is we try to close the gap of what the experienced student went through and making sense of it. Right? So this is important. This is actually where the skills of the facilitator or the teacher really have to come in. How to close that gap. And second thing is actually try to stimulate a self-reflection. Okay, we want also during the debriefing students to come up and share ideas, and we want them to, we also want to raise awareness of things, of any alternative approaches that they can do and try. In debriefing also, we try to teach specific skills. Okay, we can do that during debriefing. And the two more important thing is actually we want to assimilate what they've learned, to assimilate into cognitive that can produce long-lasting effect. And then after they have assimilated, we want them to accommodate them into their behavior. Sometimes people understand or know, which is assimilate, but they do not accommodate to their behavior. It doesn't change the way how they practice. So that is actually one of the things that we try to do in debriefing, right? Now, in terms of debriefing technique, generally it is we can divide it into two. There are many approaches as I put here: the plus delta, advocacy inquiry, gas, calibration, blah blah blah, and all those things. But generally, you can divide them into a structured or an unstructured. Easy. Structured because it has a structure that when we do debriefing we have to follow. Unstructured is actually we don't have a structure, so we just do it as what we want. All right. So when to do this thing, I think that most probably we come in another session that we have to talk about structured and unstructured. But generally, for you to just to understand, example of the unstructured is the plus delta. One of the earlier one, as the words plus delta. Plus is good, right? Everything plus is good. Delta means change. It's a symbol of change, delta. So it is what are the good things that the student have learned or they have performed or they have seen, and what are the things they think they want to change. So that's why in debriefing we don't use plus minus. We don't want to highlight the negative thing. They always ways because the learning doesn't stop there. Because we say minus meaning that okay, you have made a mistake, but delta is actually how can you do it better. So we have to stimulate their thinking of how to do it better in whatever thing they have done. Okay, we can have the advocacy inquiry. I've seen you done this thing. I wonder why you do it. Something like that. That's another way of technique. Again, it's unstructured or advocacy inquiry. The question goes like that: is you advocate to what actually the student have done, but then after that you becoming like macam, I wonder lah, why you do it? Something like that. So that is like the technique of advocacy inquiry. You have the gas calibration and so on. Banyak sangat. So I will not go into detail of this thing. It takes another session or another few sessions actually to cover all this thing. But having said that, the more important thing, if you talk about structured debriefing, generally is being divided into 3 phases. All right. The first phase is called description. The second phase is analysis. And the third phase is application. That's generally. So description is actually where we want the student describe what did they feel, what they went through. It's actually where we try to make them come to the same level as everybody else in the description phase. All right. This is where also we're trying to tackle the emotion part. When we talk about debriefing, the emotion is actually important that we need to tackle right from the beginning. Okay. That's make debriefing a bit unique than many other things because I think as I mentioned previously to many people, debriefing originates from the army, where they come back from after they go to the war. I mean, they go to for activity, some tasks, they come back and they debrief. So that's why you have this element of trying to ventilate what you feel or you see and trying to get everybody to try to come down to things. So description, it's called description. Why? It's actually also for them to describe what actually we are looking for. Now, analysis is where the more teaching learning happening during the analysis phase, and application is actually they need to be able to take the knowledge that they have basically generate the concept they have already conceptualized, able to know when to apply this kind of thing. All right. And therefore, the discussion in debriefing is more broad, all right, rather than focus. And the discussion should basically get towards not to find fault in the experience or what the student have done, but more towards a positive things to generate their bigger perspective towards things lah. Okay, so and if people say that debriefing is just like interrogation, no, it's not interrogation. Okay, it's learning, it's wanting to find out why do the student think that way. All right. Now, okay, that's actually the first part of my talk. Now, this is actually the one that I'm going to share with you. This technique called debrief technique, DEBRIF. Now, it is not the debrief that you if you type in the internet, you will already find debrief technique. That is actually also the one that's created by the army. This is actually the small e, not the big E. Okay, it's a debrief technique. Okay, so what is this debrief technique? It's basically taken from the acronym of debriefing itself. And basically D means diffuse and delineate, because second thing, B is to bring back the experience that they have gone through. And R is actually when we bring the discussion into review of what they do, why they do, and the reasoning behind it. And I is actually the in-depth discussions for certain things that we just try to discuss. If you want to bring it deeper, we try to bring into the in-depth discussion. E, there may be certain thing that we as educators have to explain, but this is an optional phase. And F is a future use. Okay. So this is so basically the process is like this. So when we meet the student, we have to start with the diffuse first, and then after that, the rest of the process comes. We delineate what we want to learn. We try to bring back the experience, and then once we bring back that experience, if that experience basically is in line with what our delineation of the learning objective is, then we try to review it. Okay. And after that, we go to in-depth discussion, future use, and after that goes to this thing. Okay, let's go to one by one. Diffuse. Diffuse, the aim of diffuse for this phase of this discussion is to manage the emotion or the anxiety. All right, this is actually the most important thing, because when people have done active learning, they're excited. Adrenaline will always be secreted during this phase of learning. So if you just keep them into that high energy thing, the learning might not take place. So we have to bring the emotion down. We need to understand. Sometimes they feel scared, not only anxiety, but they feel scared. So this all have to be this thing. I bet you when we do rounds, clinical rounds, I'm sure some of the housemen or some of the doctors feel scared of certain doctors. So these are the things that we need to tackle first before we start anything. And also we need to diffuse any misconception. If we found that certain thing is not right, maybe we can highlight that if that thing is not already in our learning objective. So in this thing, actually what we do is we let them ventilate, all right? Let them speak out, let them to speak, speak their minds out. And some of the question prompt that we can use is actually we can use the technique, we can use a question like, how do you feel? Okay, are you okay? Okay, these are, or we can use prompts like, like to share what you're thinking about now? So something like that. Or what do you think of the simulation? So these are some of the prompts that educators can use to do this diffuse thing, and give time for the student to speak out. All right, because that is actually very important. Now, when I say again, like the other thing that we need to diffuse right from the beginning is the misconception. We have to identify the what actually has been the misconception is. We have to clarify that. Okay, when I say misconception, is the big thing in the process of learning. Oh, sorry. Okay. Now delineate. My slide doesn't work. Okay, delineate. All right. After we have bring down the emotions down, everything, the next thing we go to what we want to discuss or want to learn. This is actually the learning objective. So it's a clear intention of what is the learning objective for that discussion. We tell the student, okay, in this discussion, we're going to talk about one, let's say, how to do CPR. Second thing, how to do an airway management, or how to tackle the airway in someone who is doing CPR. And the third thing is actually want to see whether your hand placement is correct. So be clear right from the beginning of this. So that's actually on what we call as we delineate. So why this delineation is important in this thing? Because it basically lay down the field, actually what we are going to discuss. We put down the boundaries, what we are going to discuss, rather than let the student wondering, ni nak bincang ke tak ni? Apa nak cerita apa? So we don't do that. We don't play hide and seek with the student. All right. So some of the prompts that we can say in this session, we are going to discuss about blah, blah, blah. Or the learning issues for this area, for this time is what? So this is what we do. Then, after we've done these two phases, we go to the next phases, which is the bring back. This is where actually, I call it, it's important for Asian students, especially. Why? Okay. Now, the aim of the bring back is to reconnect the experience the learners went through. So it allows the learners to narrate the experience that they have gone through. Okay, and this kind of thing helps in terms of learner who doesn't speak well, because those who don't speak well, sometimes they have difficulty in, because they're organizing their sentences, their phrase, or they don't know what to actually to tell. So this is where actually, as a simple term, we just said, okay, can you tell us what happened just now? That's very big. Or would you like to share how you perform, blah, 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 certain thing on those things. So it helps the student to focus on what they're going to speak. All right. So we can either bring back into the entire event, all right, or we bring back to a specific event. And it can be a single person bring back telling the stories, or we can have many team members telling the stories. And this is actually one of the difference between this technique of debriefing and the other technique of debriefing that I learned from the West. In the West, you don't have to teach the student how to speak. They just speak freely. They are so expressive. Maybe they went into this acting class right from the beginning, or how to express themselves. In Malaysia, okay, I have the experience of teaching in Malaysia, Singapore, Brunei, Thailand, Philippines, Vietnam, a lot of Indonesia, a lot of us, Southeast Asia, except Philippines, a lot of us in Southeast Asia have difficulty in basically want to share their thing, especially students to teachers. This is difficult. Tak kira lah where. Even Singapore, to my surprise, even in Singapore, I also face this problem when I teach them ETLS and all this thing. Except Filipinos. Filipinos are, they are basically like born talkers, so they can talk like nobody business. So these are the things. So what to talk? So initially, when I come back from overseas and use the gas technique for debriefing, I always have problem to engage my student in talking. They don't talk. Until I make it like, I say, oh, student kita ni memang pendiam dan sebagainya. They don't talk. But actually, when I sit in the canteen and listen, they talk. They really talk, right? Dia suka bercerita. They like to cerita. And that's why Nabil will say, cerita. So you cuba cerita lah. So let them cerita. So when they let them cerita or let them tell the story, they become more comfortable in speaking to you. So is like the ice breaking that you have to do. Okay. So as I said, I do it for a focus event, or I can do it as an entire event. Focus event is actually, if my learning objective is I want to tackle on the hand placement during CPR, I just focus on that. Or if I want to see how they approach the collapse patient, I just do it. Okay, just tell me, can you just tell me what happened from the beginning when you come in and see this patient? Oh, I do this thing, doctor, and so on and so on. Okay, now as they speak, as they bring back to this thing, and when it's good if you have like many people. You can get macam seorang cerita sikit and the other person sambung and the other person sambung. The theme is actually to get everybody in the same page. So that you know that everybody is actually following the story. If they don't follow the story, you know that they cannot continue the story. All right. Now, your job as a debriefer or as a facilitator, or my job, is basically to identify the issue that has been outlined in the delineation phase. So when they come to that part, that is when the question of review and reasoning comes in. Okay, so the review is to review what the learner says, understand, and also the reason why they're doing it. Okay, sometimes some people do things because why? Because the book says so. Certain things, they do things why? Because their friend do it. That is not good in clinical learning. Okay, we don't want to have doctors or students who basically just memorize things. All right, but we want to know, we want to make sure that they really have the understanding, the knowledge about it, and why they do it. I think that's the more important. And so to do this part or to execute this, if we are talking about topics, with the question that come up is actually what, how, when, and where. And if we want to understand the learner's point of view, all right, this is where we put the question of why you do this kind of thing. So sometimes you can ask like 6 why or 5 why until you really understand, until you really are comfortable of that the student really knows of this thing. Sometimes they stuck. So when they stuck, this is where you have to use your experience and knowledge. Instead of just blabbing out and tell them the answer, you just try to rephrase the questions so that they're able to relate between their knowledge that they have and the experience that they are facing right now. So this is actually the skills that it takes. All right. So, and these are some of the prompts that you can use. So what could be the cause of a certain sign and symptoms or disease? So can you tell me how, for example, a disease brings about that symptoms? Okay, this is actually we can do during rounds also. All right. Or can you please explain to us when is the appropriate time to perform this kind of intervention or procedures? So let them answer. Okay, these are some of the prompts that we created together with this debrief technique. Or why do you decided to do certain things? Okay, a lot of times we as educators or even we as clinicians, we don't stop to ask why. We do rounds and then basically our juniors or our doctors, this one I given here, I given this, I refer that, I put this and all these things, and then we just take it out. It's okay, fine, acceptable. Maybe it's good for service, maybe it's okay, I will not say good, maybe it's okay for service round, but for academic or teaching round, it is not good. Even though as simple as, why you do full blood count? Why do you need to do a full blood count on this patient? Why? Okay. Or why you have to sit the patient up? Why can't you just pick him and let the patient rest lying down? So why? Because we want to know what the student is thinking. We're not going, again, when we're doing debriefing, we're not trying to judge the candidates or judge the students. We're trying to understand what is going on in the back of their mind. That's the aim of debriefing, right? Okay. Now, reviewing, okay, understanding and knowing the reasoning sometimes is not enough. We want the student to go deeper. We want the student to really go in depth of what is actually they are dealing with. So this is where the in-depth discussion comes in. Again, you're still within the same topic that you have stopped for the first time, and this is where you try to explore the deeper understanding, the critical or the innovative thinking of what the student think about a certain thing. Okay, and usually how I do this is actually I put a hypothetical situation, really sometimes not about the simulation or not about the patient that we're talking about, but hypothetical situation about the disease or about the thing that they do, and we get, that's it. And it's always that, let's start with let's say, or what if, or why not. So these are the questions that we use to stimulate. What if this patient, okay, patient comes in with example in a simulation about let's say we talk about cardiac arrest and we resuscitate the patient, and the students just take the defibrillator and shock the patient. Shock the mannequin. So that's good. Okay, why reason? Because they have this. Now the question they should ask: what if the defibrillator doesn't discharge the electricity? What do you do next? What if suddenly the rhythm change from a shockable to a non-shockable rhythm? Let's say suddenly you found there is a lot of gels onto the patient's chest. So let them think, which is not there. The situation is not there. It's a hypothetical situation, but it basically try to stimulate the student think outside the box. So you start with what if and follow with why, and then why not. That's basically the flow of questions that you can ask them. Don't be surprised that the student will be able to think and answer if you give them enough opportunity, if you ask them the correct question. All right. Now, this is the part that I don't really like, but a lot of others would like, if you do, is actually explanation. Okay, if you look at most of the debriefing technique, if you've been reading about debriefing, basically explanation or telling things from the basically like the teaching session is actually a no. You are not encouraged to do that. But in Malaysia or in this part of the world or in Southeast Asia, I think explanation still plays a role. But do not convert the explanation session into a mini lecture. I think that's this thing. But unfortunately, when some of us are doing this thing, they always like, when it comes to explanation, yes, I will tell the whole story of the lecture. So the debriefing goes for half an hour. The student talk for about 5 to 7 minutes, and the other 25 or 22 minutes is actually where the lecturer gave the lecture. That is actually not debriefing. Okay, and I've attended a session called debriefing by someone, and they say, okay, we want you to talk, but we audience, about 25 of us, can only talk for 5 minutes, and the other 1 hour is that the debriefer talk. So I just wonder what's debriefing is that. So and I think I can tell you, a lot of us, including myself, sometimes kita tersilap, we try to get carried away because it's easier to explain rather to ask question. If you try to do it on your student, sometimes it's difficult to ask correct question that your student will be able to answer to what actually you want. So that is the challenge lah. And this phase of explanation can be omitted if all of the LOs has already been achieved. No point to say out, because in debriefing is not what you can show off to your student that I know a lot. So see, this is my knowledge, so I know a lot, so I can explain everything to you. No, it's not. Again, debriefing is a process of we, the teachers, trying to understand what going on in the student's mind, right? And finally, we in debriefing, we have to have this. The student should be able to know what is the future use of the new knowledge that they have already gathered. The application of part of it, all right? There's no point knowing things, but if you don't know how to apply, not in clinical medicine. I think clinical medicine, we need all our graduates or all our students to know how to apply this thing. Okay, that's when they're able to know, oh, the knowledge that I learned is actually for this, you know? So learners should be able to show generalizations in relation to its application, which is assimilation and accommodation, and how it can or will change their practice, what they have learned, okay? So some of the prompts, again, that you can use for this kind of thing, which I use, is basically how are you going to apply what you've learned today on the next case that you see, or what the aspect of the skill is beneficial to you and why. Okay, so or in what way does this going to influence the management of your next patient? So these are the things that some of the prompts that you can use in when you do the debrief technique. Now, just a bit more of sharing. I've used debriefing in simulation teaching, and I've used debriefing on the floor teaching or clinical floor during rounds and so on, because there are some similarities into this kind of thing. Okay, let's see. When we use diffuse and delineate for simulation teaching, is we want to tackle the emotion and the misconception, and then we delineate with this. We tell them what we're going to discuss, basically about the disease, how we have treat this patient, and what do we use to treat. And the practice. But in the clinical floor, the same thing. We talk about the diagnosis. The aim is actually the diagnosis. What are the treatment method and what are the tools we're going to use for treating this kind of thing. And to reduce anxiety, you can tell a joke or crack or something lah. This is something you have to take from this thing. So make your clinical floor, the rounds, the clinical rounds, to be more exciting into this thing. And during the simulation, when we say it's bring back, we ask the student to relay the scenario. In clinical floor, it's basically asking the houseman or whoever follow your rounds to present the history. Sama apa? It's the same thing. All right. And the review is actually in the simulation, we try to do what's the reason, the reasoning and the decisions. And for the review, we want to say, we can review why, if a diagnosis, if let's say the aim of discussion of diagnosis, we want to know what's the reason for that diagnosis, and the decision that leads you to do that. So this is actually the similarities. In depth, also then we can explore this thing in clinical round to explore the hypothetical situation. If this case coming with this, but without that, how are we going to manage this patient? So it opens up their mind in managing the next case. Okay, again, in simulation, the explanation is we only explain the salient point. Same goes in clinical floor. Sometimes we don't explain all this thing, or sometimes there's certain things, there's something new things we need to explain. Okay, so here we can see a lot of similarities. And the end, the future use, which normally in the clinical floor we don't do, but we normally actually, for me, I will do it. Is how are we going to use this new knowledge? Okay. Okay, now you know that you can give GTN infusion, but you have to look into all this kind of, you can start high, you can start low. So how are you going to use it in your next patient? How are you going to differentiate that? So that's how you can use this same technique of debrief even in the clinical floor. And your MOs or your trainee will find that the rounds will be slightly more interesting rather than punish them all the time. Okay. Sorry. All right. So in conclusion, experience is one of the method of learning. So therefore, debriefing is actually how we can convert the experience into a learning thing rather than just experience. Okay. And debrief is a simple structured debriefing method, which is very practical to be used in not only in simulation but also in clinical teaching. We need to train our doctors to be someone who is knowledgeable, competent, able to think out of the box, compassionate, and safe. And I think debrief is one of the potential approach that we can use to train our student or even trainees. So, all right, we come to the end, but we not finished yet. I have another Mentimeter for you to do. Again, you can still go to the same code. All right. For those of you who have joined us, the code is 45283746. All right, and try to answer that question. I give you about 45 minutes for this slide to go.
You mean 45 seconds?
40 seconds, sorry, 45 seconds. All right. Yes. Sorry. 10 more seconds. Okay. All right. Let's see. Hisham, can you share the slide? Oh. All right. 100%. Only 13 people who attempt this. Okay. Anybody else? All right, but that's fine. If you don't want to attempt this, that's fine. But I mean, it gives you another option of how to do your clinical teaching. This is one of the way you can try to do it. Okay, so if you want to know more about this thing, we have developed an app for this debrief technique. We have basically put it on our society website, or we're going to put it on our society website soon. All right. The society is the Malaysian Society for Simulation in Healthcare. So you just type in www.masshmesh.com.my, then you can basically go to the website and basically visit our society, and we try to provide things so that will be beneficial to everyone. Okay, with that, I thank you, and I pass this back to Prof. Tom.
Thank you, Ismail. And time for debrief.
All right.
Welcome question, and everybody, and reflecting back on our experience, and is there differences, similarity, what you have teached, and feedback, see whether you have done. Some of you may have just done some debrief, some a long way, some steps, but not. So well, time for discussion and clarifying and things that you want to clarify. Yeah.
Okay, there's one question on the thing. Say, how long does this take? All right. Now, the answer is it depends on the thing that you are. Sorry, what is it? Okay. It depends on the session. It depends on your learning objective. If your learning objective banyak, it's a lot, then therefore it's actually quite long. If you're learning, so that's why usually we try to keep about 2 to 3 learning objectives so that we can distinguish. There are some people who basically saying that it should be like double to the time of your activity, meaning that if you're doing simulation teaching or active learning, let's say the learning session is like 15 minutes, then the debriefing should be half an hour. But to me, it depends on those things. So as long as you have understood what actually going on in your student mind, and as long as you know what they've learned according to the learning objective, and they can use those things, to me that is enough. And usually tak lama lah, it's about roughly about 15 or 20, or the most we debrief is about half an hour. Okay, and that is roughly about 3-4 LOs that we discuss.
I just thinking about review that in the debriefed the mornings, the review. Does it provoke anxiety I mean, because you are reviewing, sometimes students reviewing what they are doing, so they are always thinking about looking back at their mistakes and
Yes,
the
of course.
reason. Yeah.
The student will always look at it, and that's why we cannot go start with review. It's always have to start with diffuse and bring back. This is actually where we feel settled down. There will be some anxiety, but the way how you approach the questions actually can really bring it down for this thing, as that you are, I mean, a part of the friends, and you have to keep on telling them that we are not going to penalize you. And not only that, it's not only okay that you have to say that we'll not penalize you. You have to really not penalize, because once they see, oh, you ini cari salah aja, then they will still keep quiet. So that's why I said, well, people ask me, say, debriefing is the same as feedback, because one of the key thing about feedback is actually you judge the process, you judge the thing that the performance. In debriefing, we don't judge. We try to understand. That's the biggest difference. Even though with feedback, they have this elaborative feedback or facility feedback, you can ask more questions, get the student to talk more. It's not about student talking more or talking less. It's actually for us to understand what actually going on. So that's like, to me, like two big things that a bit mencapah lah. It's literally like diverse or between debriefing and feedback. Within debriefing, actually, there is element of feedback. All right, there are. But the feedback that you have to deliver is have to be an elaborative feedback. It cannot be rarely that you say, that's right, oh, that's wrong. You see, if it's right, then the explanation have to come in why it is right. Or they themselves can discover that with your further question. So that are the thing. Of course, anyone goes through with this thing, but once you have gone through the debriefing, a lot of time the student doesn't feel intimidated. I think that's one of the things that we get at the end of this thing when we do courses like the AHA courses, or we do this teaching for medical students or master students. The good thing is actually at the end of it, during our disaster training, they don't feel intimidated. They feel enjoy and they want me more. And I asked them this question directly. I said, do you feel macam takut ke sekarang? Tak adalah, Prof, okay je. You know, because why? Because they consider you now as their colleagues or their friends. You are no longer their big boss or big lecturer or something. So that is how we're able to bring the discussion into, like, kita ni sama aja. It's just like as a friend, you know, like education 4.0. It's like, it's not as the teacher as the center of this the stage on the stage. Okay, it's more of like guide from the side. So this is actually how we do it in debriefing, and I think it works nicely with education 4.0.
Yep. Professor, you have.
Right. Thank you, Prof. Ismail, for the very enlightening session. I think it explains to many of us, I think, what debriefing is all about. I've been through it before with you, so I suppose I know quite a bit more about debriefing by now. But I think we are all looking forward to the apps that you're going to demonstrate soon to us.
Inshallah. The moment we will get the app up. Okay, the app is already ready. Okay. It's now in the process of basically getting the app developer negotiating with the website developer and basically put it on. Itu saja.
I thought you were going to demonstrate it today.
The website developer kata dia belum ready.
Oh, okay, right.
So nak buat macam mana? Unless we can download the app on a university punya ni. I think there's no harm, right? And people can come to university and use, because we need a website that can host this app. That's actually the issue now. We have developed this app, so we want a host that can host this thing. So I was thinking that the MASH society website is okay, but tak ready lagi sampai sekarang. Itu one of the thing lah. So kalau tak ready juga, maybe in the future we do it. I don't know. If we can put it on the university punya atau Fakulti Perubatan punya website kot. Kalau dibenarkan lah.
Is it free? That's a question.
Free. It's free.
Okay.
We are looking forward to it today. Actually, I thought you're going to show it today.
Yalah, I also looking forward to it lah, tapi tak dapat. Nak macam mana? Okay.
But just to clarify that the app basically, how does the app help? Is a steps that we can actually help us to go through the process.
Yeah, it's basically okay. Now, like example, you have something to discuss. It allows you to choose whether it's going to discuss about a disease, or you want to discuss about an intervention, or you discuss about a tool that you use for the intervention, something like that. So you just key in what is your title, your topic is, okay, and then basically the app will basically have questions that basically lists down that you can pick and choose to go along with your topics. Okay, and basically we tackle the diffuse, delineate, bring back, review, reasoning, in-depth discussion, and all these things. So by following those steps, you're able to basically like being guided of doing how this guided reflection is. So this debriefing. So we hope that people learned, but I can tell you that still a proper class of this thing will be much better in terms of learning this debriefing, because I myself take quite some time to really be comfortable of handling questions or basically asking questions, because you know why, sometimes kita tak tahu apa nak tanya, and example macam pagi tadi pun sometimes kita tengok macam kita tahu apa nak macam our interview, right, we know actually what to ask, already ada prompt, tapi how to phrase that question, itu sebenarnya memberi satu masalah kepada kita. And when the phrasing is tak tepat, student tak boleh nak jawab soalan kita, dan kita tak dapat for this thing. That's the skill. The skill of learning nowadays is actually asking questions rather than telling them the thing lah.
Yes.
Okay, there are a few questions there. Okay, the app free or need to buy? Free. Since third app developer involved, yeah, it's free. What kind of student that's suitable with the method in the app, based on academic or insight, etc. I don't really understand the question, but saya rasa benda ni siapa-siapa pun boleh, undergraduate, postgraduate pun you can use it for this thing. Oh, kalau macam kadang-kadang kan kita dulu I used to use this thing when I do my SPPU. So at the end of the year, when we're supposed to meet our staff and basically discuss their performance, right? Performance review. I use Debrief for those things. So that's also how you can do it. So you can understand your staff better. What? Oh, okay. Dia ni sebenarnya macam ni rupanya dia fikir. So you can use it easily lah. But again, I said the app is good, but a proper training, a face-to-face, a workshop, I think that will help better people to understand and use it. Sometimes people understand but don't use it pun dia tak berapa bagus, sebab dia tahu je, tapi bila nak pakai when they come to relating kan, macam I teach you how to sing, okay, you know how to sing, you have to go high note, low note, tapi when you go in front of the audience and really pegang that mic to sing, nanti macam-macam ada. So it need practice.
I'm not sure. Is that Dr. Hasni is clarify your question, or do you have something else in mind?
Yeah, but I've been thinking about the the students similar, they are not homogeneous, they're heterogeneous,
Betul?
Yeah, so is it apply to those of them? I mean, maybe the poor academic quite difficult to understand what we are, to what the flow we going to, some students don't have insight, they know what they think. So that's maybe the problem. Yeah, I don't know.
Okay.
Yeah, your experience, Prof.
I think macam student kalau kita nak tackle group besar tu susah sikit lah. Sekaligus group besar kan, to understand one by one for this thing. But if we meet them couple of times, berapa kali kita can basically try to understand bit by bit. Again, this is not something like satu magic bullet everything can settle, tidak. Cuma kita tak boleh ada negative perception pada student right from the beginning. Macam kita kata, oh dia orang ada this type of mentality, so tak boleh buat apa-apa. Then I think that debriefing will not work kat situ. Sebab kita dah ada letak kita punya barrier. Kita basically have to go open. Sebab kita betul-betul nak pergi nak faham. Kita cuba nak faham kenapa student kita macam ni. And maybe if I can share here, I hope Prof Zaliha tak marah lah. This is actually one of the debriefing that I did with our student. 3 of them datang, kita borak-borak and all this thing pasal teaching lah. And then dia kata, saya kata kami sebenarnya malas nak apa, macam dia tak ada mood lah nak belajar, bukan belajar, asking question. Kan kita habis lecture kita kata, okay, any question? So usually no question. So I began to I want to find out kenapa student tak ada question. Okay, so some of the student punya respond when I do debriefing on them, I found out that dia kata, okay, this is what they said. Kadang-kadang malas lah kami nak tanya soalan sebab bila kami tanya soalan, dia pada lecturer kata cari sendiri. Okay, kami dah cari, kami bawa balik soalan tu pada lecturer, and then lecturer bukan kata ya atau tidak, dia kata itu pun you tak tahu. You know, jadi dia kata at least confirm lah betul ke tidak. Kalau macam tu tak payahlah, dia kata tanya soalan lagi, better cari sendiri. Then saya tanya dia, kenapa you boleh bercakap dengan saya macam tu? Saya pun lecturer kan for this thing. Tapi dia kata Prof bukan daripada department tu. Oh, okay. So then that's adalah department yang cakap tu.
Pasal department ONG lah ni.
Tak kata you assumption.
Sebab nama saya tadi.
So see, the thing is that kenapa tahu? Kita tak stop for a while, pause and basically tanya student apa sebenarnya yang dia nak. So these are the things lah. Well, I will not say that we know all the student problem. Tidak. I think it's not. But I think we should start trying to understand. Then we can pitch our teaching lebih mudah dengan student lah.
But actually, if I may add, addressing Prof Hasni punya question tadi tu, having gone through some degree of debriefing coaching, I think probably it is actually best suited for a heterogeneous group of students because it's a two-way thing. So you learn about your students at the same time as well because you ask for their input into the learning. So you would be able to judge where they are, what the difficulties are and all that, you know, rather than a one-way traffic. Is that right?
You are asking or you are telling?
That's my perception
okay.
of what debriefing is about. You know, I think it actually helps the teacher to understand the students better.
Okay.
You know, rather than say a one-way traffic kind of input to the students or feedback or whatever you call it.
Okay. So you meaning the one-way traffic tu makna kita bagi tahu student?
Yeah, but in debriefing, you actually ask the student how they feel, what they have gone through, what they think about the whole session and all that. So you learn about your students, you know, whilst you give your feedback to them at the same time. So I think it caters better for a heterogeneous population because
dia sebenarnya pada saya
you can tailor it.
Dia depend on the LO, Prof. Kalau LO kita untuk mengajar, then bagus homogeneous lah kan untuk mengajar. Kalau LO kita lebih untuk mencari sebab dan sebagainya, then we can use heterogeneous dan sebagainya lah. Dia bergantung pada LO, apa yang kita nak, what's the learning, the objective of those discussion is for this thing. Like I said, this is a tool, you can use it in many different way for many different reasons. The important thing is actually for us to try to master the technique, and then you can use it in macam-macam cara lah.
I have a last question. I mean, have you done debriefing in a pen and paper pencil technique? I mean, some of the students have different learning style, and I think one of the things is that when you ask them to review, they don't want to say anything because they are not used to the talking way of learning. They might write better. So some of our session, I ask them to write down. If those who want to write down, you write down. Those who say, you ask. Like, you know, in Mentimeter, sometimes they like to answer, but they don't want to say anything. So different learning style. But have you tried asking them to write down on the mnemonics of debriefing?
Well, not really. I've not done that. Asking students to write down on this thing. Because the reason is actually when we debriefing, the first question is the opener. We'd have to be, and the next question that follows depends on what the student responds. If they write and basically they give it to me immediately and I can read the answer and then I can ask the next question, that is okay. But if not, dia akan jadi macam hanging saja.
Yeah, no.
Dia susah. Then it doesn't become debriefing, they become reflection.
Correct.
So actually debriefing ni ialah if people try to understand it, dia macam reflection. It is exactly reflection as I mentioned just now, but it's a facilitated reflection. Because when we ask students to write reflection, they do it on their own, they write it down, but nobody guide them on what to write, what to think, what else to explore. For debriefing, we do that.
Yeah, precisely, because writing is mainly to stimulate some initial discussion, then hopefully things will flow. One good benefit, and there's one more, I think, one good benefit of debriefing, students pay more attention during lectures because they are expecting question after that from a lecturer. Yeah. Okay. All right. Thank you. I think it's 3:30. If there's any question, we can, those who want to leave can, because it's officially is 1 hour, but those who want to have some questions can stay.
You can stay.
Yeah,
I'll be here until 4. I think this session is on until 4, right? So I'll be here until 4.
Yeah, there's a plus or minus lah, but
plus minus.
Yeah, officially it's 3:30.
So officially, okay. Sorry.
It's okay. Don't worry. So the people who have their errand to run, I mean, they can. So any other question? We'll just sit down for a while, and if not, we can end the session. But definitely one question.
Okay, thank you.
I actually have a comment. Just now, Prof. Zhao was mentioning about student. Well, while you're typing, we can have a little chat also. When we do, I discovered we can learn students' thinking, and learning students' thinking is as important because we know where could go wrong. Again, sorry for Ismail judging where we can go wrong, but there's an opportunity for us to discuss where the wrong comes from, and that's
because we have to remember, at the end of the day, is actually when we produce a student, we produce the graduates. The important thing is actually we want them to be a safe doctor. How they thought, how they arrange their flow of thoughts, how they deduct a disease and so on. It matters. When we do our exam, we can only test them only 1, 2, 3, 4 cases. Maybe in the whole of their life, they will not see these 4 cases, but many more, 4,000 cases are coming in. So how can we, by doing the exam or by doing that kind of thing, we can decide that, we can say that the student is safe, right? So it's actually looking actually how the approach towards things, the flow of thoughts towards things. And if they say, good, able to produce a student who doesn't just jump to conclusion. We know the student now, when they get this thing, they will consider all the differential. How they think about differential is this the way how they can differentials. And they're able to dig that. I mean, come up with the answer to this kind of thing. Then I'm happy to pass that student, for this, because in the exam, you just imagine of all the diseases, we just choose one for that essay, for that soalan kan, for that thing. And it's just based on that. So how can we say that based on that, the student is safe, or that doctor is going to be a safe doctor? So I think to understand the flow of thoughts is more important rather than to know whether they can memorize and answer this.
Yeah, I think that's an important take-home message as well for us.
Yeah, I think along those lines, it goes to show that actually debriefing is very much in line with clinical reasoning.
Yeah.
And they work together towards deep learning.
Yeah, itulah dia yang kan review and reasoning tu. Itu actually clinical reasoning, right. And the in-depth discussion is actually the deep learning for this kind of thing. Correct. So because let's say we teach students to manage MI, but how many of us teach students to manage the complicated MI together with a certain disease? So we need to see their thought process. I think that's how we can say, dia ni baguslah, sekurang-kurangnya dia tidak terus kata, ini kalau macam ni, example like macam dulu I teach trauma. Okay, dah pun teach trauma juga. Patient having we teach one of the paramedic. Kalau ada pneumothorax, tension pneumothorax, put a needle on dekat second intercostal space, make cervical line to reduce the tension pneumothorax. Sign and symptom, reduce air entry, hyperresonance and everything. So when we give a question, the question is medical question, but dia dah macam so okay, anything reduce air entry, hyperresonance, cocok. So that shows that dia tak faham, they just memorize. So itu yang kita kata bahaya orang-orang macam ni. So we need to,
true. I see that phenomenon a lot among the medical students. Unless you actually tell them and guide them that they are supposed to be more than just technical learners.
Betul. Itulah dia aim dia. We want them to be thinkers rather than just memorizer and do it this
Correct.
thing.
Yes.
Okay. Am I allowed to ask question?
Sure.
Okay. If I can pick one, I don't know who is she, but if I can just pick one, I'm sorry. Jane Lim. Who are you? Sorry.
Hi, I am from psychiatry department.
Psychiatry department. Okay. Ah, good. Can I have your, what do you think of this debriefing?
Oh, okay. I think it's a good method. I mean, I just sort of graduated from my postgraduate training. So we have been doing it for things in clinical service. So like, for example, after aggression management,
Okay.
or after, staff incident and all that. So by going through this lecture, it helps me to understand better in a more structured way. And I do agree that it stimulates learning in a positive way.
Yeah. Well, I think what you are mentioning is more of like a psychological debriefing, which is also another type of debriefing for psychological experiences, which there are similarities, but there are some differences in educational debriefing. Because selalunya kalau macam psychological debriefing, kita tak tanya dia kan, so after you learning this, how are you going to tackle if your attack come again? Okay. Sorry. Just
How do you want to manage
similar things? Yeah. Okay.
Yeah.
Okay, thank you, Jane. Thank you.
Probably that's a teaching of managing psychiatric experience teaching psychiatric emergency. But I mean, violence, things like that. Yeah. Okay.
All right. Good. I hope everybody who tune in to this afternoon find this thing a little bit beneficial, that maybe you can use it or you can learn more about it that you can use for whatever your activity is. All right.
I think for sure, for those who are intended to, almost 100% want to try that. So when they try and review back our own self as part of ourselves, and we may mess up some of the steps, but it's part of learning cycles, and it's definitely that habitual is things that we want to develop from ourselves. As partly. Okay.
In fact, I might be conducting few debriefing classes for those who are interested. I will basically keep when tak tahu lagi, tapi I'm going, most probably within this year, we're going to do few debriefing classes, and who is also interested to be part of a research team that we're going to study on this application lah. Kalau
Looking forward for that. We will disseminate the news. Okay.
Okay.
All right.
Okay.
Thank you very much. It has been a fruitful afternoon as usual, and we always sparkle discussion. Right. So thank you for all that's attending.
Gambar boleh?
Boleh.
Okay.
I'll take a picture. Okay. I'll screenshot it straight from my laptop.
Oh, Rashid pun ada.
Zaki boleh unpin all of us. Unpin all of us.
I'll put it on the gallery view, right?
Yes.
Yeah.
Right. Rosni.
Gallery view and full screen. Okay.
Tolong yang lain, Dazlin,
Ramai yang belum on lagi. Okay.
Okay.
Okay. Right. Rosnita semua. Dr. Alias, Dazlin. Tak nampak.
Ayangku.
Prof Tong. Oh, you've got. Yeah. Okay. Right. Okay. One.
Baru sampai. Dayang.
Alright. Siapa lagi?
Alias.
Dr. Alias.
Kenapa?
Baru nak muncul.
Mercedes-Benz dia keluar.
Okay, tunggu sekejap, Dr. Alias. Are you there?
Alias is using sharing the other app.
Okay, right. Okay. Kamera dia ada masalah. Wait, yeah. I'll wait for the chat to go off. Hang on.
Tutup chat.
Okay, right. Okay. 1, 2, 3, smile everyone up. Prof Ismail. Okay, right.
Okay.
Ke belakang. Tadi terpotong sikit atas.
Okay.
1, 2, 3, smile.
Thank you.
Oh, wait, hang on. ada masalah sikit pula. Alamak, kenapa dia tak save?
Okey lah, saya ambil pakai kamera.
Sekejap. Wait, 1 minute. Usually tak ada masalah. Wait. Okay. Right. Okay, 1, 2, 3. Smile. Done.
Okay. All
Thank
right.
you. Thank you very much.
Thank you.
Yeah, next
Thank
session
you
will
for
come.
listening.
All right, bye.
Thank Prof.
Thank you, Boleh.
Okay, thank you, Prof. Ismail, Prof. Long, and everyone.
Yeah.
All right.
Okay. Yeah, QR code is up. If those have not,
Oh, QR code.
yeah, if those have not clicked, you can register.
Oh, the same QR code kan? Kalau dah register tak payah lagi kan?
Yang tadi sama juga.
Oh, the same one. Okay. Alright.
Ada yang masuk lambat tadi.